Many times patients will come to us and they'll have an area in their mouth where they have a missing tooth, where they've lost a tooth for some reason. And many times the best choice for them is a dental implant. People may have heard of that, but they don't really understand how the process works, but it's very straightforward. Imagine a tooth is missing in this area and it's a good area to place an implant. The patient would be numbed, so they're very comfortable, and their gum would be moved out of the way a little bit, and then the area would be prepared in the bone to place the implant. The implant would be placed into the bone, and the implant is made of something like titanium, and it's coated with a material called hydroxyapatite, which actually bonds to the bone in your mouth. So over time, your bone will fuse to that implant. So in a posterior region like this, what we would do is once the implant is placed, we would cover the gum back over that and let it heal for about 3 months, where we know the bone has attached to the implant. At that point, we can use a digital scanner to just kind of scan that area. We send that to our lab, and they will actually design what we call the abutment and the crown. Now the implant is down in the bone, and then the abutment is the part that sticks up above the gum. That's what is designed by the lab, along with a custom-made crown. So that's the implant, the abutment, and the crown, and a tooth is replaced. Patients tell us that when they have a tooth replaced with an implant, it feels just like a natural tooth. It's like they've never lost a tooth. When they bite, when they chew, when they function, when they speak, it feels totally normal. They're very easy to clean. They have to be flossed a little bit differently than a regular tooth, but something that can be easily learned, and patients are very happy when they get a tooth replaced with an implant. I had a situation recently, though, where a patient was in a very serious traumatic injury at work, and they lost 5 teeth in this area, which is a pretty big defect. They couldn't smile anymore. They really felt very self-conscious, and we needed to rebuild them. So in that case, we were able to put 3 implants in that area, and then we created a prosthesis that actually replaced the 5 teeth. It looked completely natural. We were able to bond that onto the implants. The patient now can smile, he can chew, he can bite into a taco or a sandwich, he can speak normally, he looks as normal as you and me. It really gave him his smile back. So implants can be useful for replacing a single tooth or even replacing a large situation, for example, in a traumatic injury, and really benefit our patients. We always want to do things that are going to cause our patients to have a better self-esteem and feel good about their smile so they can function, speak, chew, and feel happy about themselves again.